Hello, my name is Nancy Weiss. I'm in the Master's Program for Nursing Education at the University of Texas in El Paso. My presentation is about asthma, including what is asthma, the symptoms, the triggers, the prevention, the treatment, how to monitor the treatment of asthma, and what lifestyle changes that you can make to help with your asthma. Some interesting facts about asthma. In 2015, an estimated 18.4 million adults had asthma. 3,396 adults died because of asthma. Many people with asthma as a child can become asymptomatic, meaning they're not showing any types of symptoms during adolescence. But asthma can return in adulthood, especially if the patient had severe asthma as a child. Overweight and obese individuals are at risk of asthma in comparison to normal weight counterparts, and receiving both the yearly influenza and pneumococcal vaccine based on age can reduce the complications in an asthmatic patient. So it's quite important to get your vaccines. So what is asthma? Asthmatics have a different type of inflammation in their airways that when exposed to certain triggers, it causes the airways to narrow, which makes it hard to breathe and can cause wheezing. As you can see in the picture, the airway on the left side is wide and open, and the airway on the right side has a lot of constriction. Closure is where the wheezing part comes in. When you can hear it, it goes, ah, ah. It's really very obvious. Diagnosis of asthma is apparent from the symptoms, but also other studies such as a lung function test, blood tests, and chest imaging can be used to diagnose asthma. Symptoms of asthma are shortness of breath, cough, wheezing, chest tightness. They can be worse at night, and if the symptoms are not relieved, they can cause an attack. Some of the triggers of asthma are endogenous, which means these are things you can't control sometimes, like your genetic predisposition, which means your genes just gave it to you, gender, elasticity, airway hyperresponsiveness. Then there's the environmental factors, of course. Indoor allergens, outdoor allergens, passive smoking, active smoking, respiratory infections, acetaminophen, which is Tylenol. Sometimes you can even get an asthma attack by just taking Tylenol. Then there's just the triggers, which are allergens such as dog and cats, cockroaches, grass, pollen, ragweed, tree pollen, fungal spores, upper airway, upper respiratory tract and viral infections, exercise, cold air, laughter, and even strong smells like perfume can trigger an asthma attack. Irritants, stress, and they say that beta blockers, which is a drug, can even worsen your asthma and can be fatal. So it's very important for you to tell your physician what type of drugs you're taking. Treatment of asthma. The recommended approach is a stepwise system, and this is how you can manage the symptoms. So there's relievers, which are inhalers that are short-acting for acute symptoms. That means the ones that all of a sudden happen. Controllers, which are taken daily, reduce the airway inflammation and the onset of symptoms. These inhalers are used normally for persistent asthma, and it keeps all of the symptoms at bay. There's also oral medications, such as corticosteroids, and it's used for acute severe asthma and only for a short term. And then there's the anti-leukotrienes, which is the Montelukast, and it's used daily to help control the asthma. Education is key in preventing an asthma attack. Recognize when asthma control is deteriorating and what to do about it. Have your action plan ready. Make sure that you know what your current medications are. Look at your asthma as a traffic light. Green means that you're well managed. Yellow means that you're moderately bad. Red means you need to be going to the emergency room. And take steps before the symptoms turn severe. Monitoring your asthma treatment by keeping a journal and documenting the triggers that cause your asthma symptoms. Take your medications as prescribed and visit your physician regularly. Don't forget the journal. So lifestyle changes include getting an annual flu shot. Take your medications as prescribed. Know what your triggers are. Avoid them. If you know that you're allergic to cats and it causes you to cough more than when you don't have a cat around you, don't go near the cat. Do weight loss. Have dietary changes. Sometimes eating something can trigger an asthma attack, like avocados. Know your asthma action plan. Stay away from smokers and smoking. This is definitely key in preventing an asthma attack. Thank you so much. I hope you guys have a great day.